So any eligible home renovations that you do between tomorrow and December 31st, 2022, up to $20,000 over the next 27 months will qualify for this new tax credit, saving you up to $2,100 on the cost of your home improvements. There will be a long list of eligible expenses, including renovations to your kitchen, to your bathroom, or to your basement. New shingles, new carpet, hardwood floors would all be eligible. New paint, inside or outside of your home. Pretty much anything that is a permanent addition to your home. So it doesn't include things such as furniture, such as televisions, appliances, and other electronic equipment, or such things as hot tubs would not be included. We expect the program will cost about $124 million over the next 2 years, which means it's going to save Saskatchewan homeowners and Saskatchewan families $124 million. That's money back in their pocket. That's based on $1.2 billion worth of home renovation activity that has occurred. That's a lot of building, that's a lot of spending, and that's a lot of hiring right here in this province. Recently, a number of building industry associations from every part of Canada presented a paper to the federal government. They were calling for a home renovation tax credit similar to the one that was introduced as an economic stimulus during the recession in 2009. They cited a very positive, stimulative effect that tax credit had in generating economic activity and creating new jobs to help Canada emerge from what was then a recession. This study also said that it would have a similar effect now as we work in this nation and in this province to recover from this global pandemic. Well, we agree. But it's just one way that we are driving a strong recovery and building a strong Saskatchewan. The new home renovation tax credit will complement other measures intended to boost the economic activity in the province. In the last provincial budget, we cut the PST on new home construction. And we've introduced a 2-year, $7.5 billion program to support that economic recovery. Across Saskatchewan, we are investing in schools, we are investing in hospitals, in highways, long-term care homes, utility services, as well as investing alongside our municipalities in municipal infrastructure. That means $7.5 billion of economic activity and job creation in every part of the great province of Saskatchewan. The new Saskatchewan Home Renovation Tax Credit will further support our construction industry at what is a very crucial time. It will make life more affordable for Saskatchewan families, and it will further help us drive our Saskatchewan economic recovery. That is an important part of our plan for a stronger province, for a stronger Saskatchewan. So I'll be pleased to take any questions that you may have. Seeing none, we'll carry on with our day. Not quite. Welcome to Saskatoon, Stephanie. I don't think we have a microphone here, so just any... Alex, I'll bet you have a question.
I do have a question. So in the last quarter, residential migration was down significantly. And I'm curious about how that plays into your narrative of population growth and that's built into your growth plan and also sort of what you've been pushing as a party for many years.
Right. No, we are going to see some, ups and downs with respect to not only interprovincial migration, population numbers, but even some of our employment numbers over the next period of time. We're very fortunate in the province right now where we have the lowest unemployment rate in Canada, which means people are returning to work here in Saskatchewan. But we are still in the midst of a global pandemic. We are preparing to recover post that pandemic and to grow and not only recover to pre-COVID levels, but to grow and to continue to grow like we have over the course of the last decade. So I think it's important for us to always acknowledge that we are still in the midst of a pandemic, but to always be thinking about how do we best prepare and how do we best position this province for the economic recovery, and how do we best position this province for ultimately getting back to growing as a province, not only from the perspective of economic growth, but growing with the affordability that we're offering families here in Saskatchewan. Listen, we have had a tremendous 10-year growth spurt. The highest degree of growth that we have had since the inception of the province of Saskatchewan over the course of the last 10 years. That's something we want to continue. And the way to do that is, I always say it's not that complicated. The recipe for success in Saskatchewan is ultimately that we create jobs, we create careers, we create that opportunity for people to move here. They then bring their families to this province. That creates population growth and creates opportunity for us to grow our communities. In creating those very same jobs and careers, it provides that opportunity for all our children and that next generation to choose to stay here. And that is the ultimate goal of the Saskatchewan Party, is to provide that opportunity for that next generation, to provide that opportunity for our children and ultimately our children's children. So we're still in a pandemic. We're finding our way through that. Saskatchewan is very well poised to recover and grow, and I think speaks to really what the ballot question is going to be over the course of this month is who do Saskatchewan people trust to recover and grow the economy here? What we are doing is, with respect to the larger conversation, not just around overdoses, although that is part of the conversation for sure, is ensuring that we are approaching our entire mental health. All too often, subsequent addictions at times, overdoses are a result of those addictions, and the conversation around suicides also across this province rolls into, how do we provide supports for those people that are struggling with any level of the aforementioned. We had just recently opened a number of beds in the community of Estevan dedicated solely to crystal meth rehabilitation. We just recently have announced moving forward with our urgent care centres, both in Regina and Saskatoon. A portion of those urgent care centres is going to allow for a greater continuum of care for those with mental health and addictions challenges. There are a number of ways for us to continue to have the conversation, to continue to invest in real solutions and supports for all of those in our community, including those that are struggling with mental health and, as I say, all too often the subsequent addiction challenges that come with that. We are investing, as I said, we are investing in that particular organization up to and including this year. And we will continue to invest not only in that organization, but in multiple approaches, multiple supports for all of those that, as I say, are challenged with, have mental health challenges, have addictions challenges. There's various ways that we can put forward supports for them and their families, and we'll continue to do that. This has been a point of strength with respect to the investment that this government has provided over the course of the last number of years, up many tens of millions of dollars each year into our mental health and addictions services and supports across the province, and I think that's going to continue in the years ahead. There's nothing saying that we wouldn't look at funding that as well as other initiatives in the future. There's a decision made, as there is every year, around budget priorities, around where the dollars are going to be provided, and quite frankly, when you look at the investment this past year, and I highlighted a couple of those investments, but there's many more. Why not? Why wouldn't a government fund the rehabilitation beds for crystal meth in Estevan? Those beds were beds that were quite honestly closed a number of years ago under the NDP. We reopened them and focused them in on crystal meth addiction treatment specifically, understanding that it's very different than some of the other treatment facilities that we have in this province and we have across the nation. We feel that was a very important investment at this point in time to provide that service in Estevan, to reopen that service that the NDP closed in Estevan at this point in time. So that there's a finite amount of investment that is available, and we'll continue to allocate it in what we feel is the best interest and with the best outcomes for the people of the province. That's a record. As I say, we are going to run on our record. Our record is one of investment in communities, in healthcare facilities, in the people that work in those facilities, physicians, in nurses, in all of our healthcare services in community after community. Our our record is one of investment in schools, 57 schools built thus far, more to come in the next number of years, and investment in the growing population, student population that we have across the province. We have a very strong record in this province. We're willing to run on it. You are going to see the NDP are going to run from their record. The fact of the matter is their record is one of cuts. It is one of decline. It is one of a record of governance where people actually left this province. We have faith in the prosperity and opportunities that we can provide across Saskatchewan and what Saskatchewan can be. We've experienced that over the course of the last 10 years. I put forward in the previous number of years under an NDP administration, this province wasn't growing. We were closing schools, we were closing hospitals, and people were leaving in droves. That's their record. They can't shy away from it. They'll try to run away from it, but quite frankly, they can't. Yeah, we are faring quite well with our COVID numbers, and that's a credit to the people of the province and their adherence to the public health recommendations that we have, and for that I'm eternally grateful for where we are. It's allowed us to reopen our economy. It's allowed us to ensure that much of our economy has been able to remain open throughout our response to COVID. Wait times with respect to the broader healthcare services that we all expect and require in our communities are a challenge across Canada. In my time on the Council of Federation this past year, chairing Canada's premiers, this has been paramount in the discussions that we have had with the federal government as one of the ongoing trailing investments that will be required is to catch up across Canada on our surgical wait times, our diagnostic wait times. We're back up to a very close to pre-COVID level in what is occurring in our diagnostic services as well as our surgical services here in the province. So the Saskatchewan Health Authority is doing their absolute level best to ensure that we are getting people in to see their specialists as soon as we are able. But you highlight a national problem, quite honestly, it may be a global challenge that we have coming. And one of the fallouts from the COVID-19 pandemic and our response to it is we are going to require further investment in the years ahead to ensure that we can gain back some of our time with respect to our surgical wait times. It's not unique to Saskatchewan in any way. We're aware of that, fully aware of that. Well, there's we can second guess things that happen on a day-to-day basis. I think I also pointed out to Arthur that in the early days we didn't have all of the information, and I think if there's something that we could have done better at in the early days was communicating with the little information that we did have as quickly and as rapidly to the people of the province. We're in a time yet today of great uncertainty. A number of months ago, I think that uncertainty was even greater. We understand this virus better today. We actually understand how we can limit the spread of this virus in our communities. You're seeing, for example, we're not very close here today, and if this was a last campaign announcement in 2016, we would try to have people lined up and down the streets. We're very, very different in what we do each and every day. And so what we understand today versus what we understand in the first number of weeks, maybe the first couple of months with this virus is we're in a much better place with a lot more certainty. But in those early days, as we were discovering how this virus was spreading, discovering what we needed to do to flatten the curve, if you remember the term that we use so often, we could have done a better job communicating just that on a maybe even a more daily basis to provide what little certainty we had, at which was a very uncertain time. There's a number of conversations happening with respect to child welfare here in the province. Some of those conversations are happening with our Indigenous communities, our Indigenous leaders, and our federal government over a federal bill that has been introduced and how we will transition some of our provincial children in care to Indigenous oversight as well as community oversight. which we think is a good thing. The more that we can keep people in their communities as opposed to moving them out of their communities when that may be required for them to move out of their home is, an important step forward, and one that we are very actively in conversation with the federal, have been up until this campaign. I'm in conversation with both our community leaders, our Indigenous leaders, as well as our federal leaders. But listen, this is an area where we need to do better, not just as government, but as society. We need to do better at taking care of that next generation. That ultimately is who is going to take care of us as we age, and so we need to do better as individuals. It's much like our response to the COVID-19 pandemic, where our collective success is only here due to the personal choices that each of us make. The same holds true in how we conduct ourselves in our home and in our society. So more work to do there, active work happening as we as at the present time, but most certainly, like many other conversations, one that needs to continue. Yeah, I don't know that it's going to take years. It will take some investment from the federal government as they move into this space. You're correct, and the federal government needs to move forward with a commitment to that investment. But I don't know that it will take years. My understanding is that there are a number of Indigenous communities in Saskatchewan that are very close to moving forward with a model that would work. And I'd give some credit to our current minister, up until a day or two ago, Paul Merriman, and the work that he had done with our 17 child and family service agreements with tribal councils across the province, as well as most recently the partnership agreement right here in Saskatoon with the Saskatoon Tribal Council, which is a further step towards ensuring that those children are having that care right in the community. Those kids are having every opportunity to succeed when they may be faced with what may be a very challenging circumstance. So I don't know that it will take years to implement. I think we're probably further down the road than that. But it will take a commitment from the federal government, a very large financial commitment as they move into this space. You are correct.
There's an HIV outbreak happening right now in East Central Saskatchewan, and last year the HIV diagnosis rose by more than 20% in the province. Now experts on the front lines are saying that your government has failed patients in the province, particularly Indigenous patients who are dying. They're getting really sick from HIV. What will your government do to tackle the HIV crisis with that?
Well, we'll continue to invest in a number of areas like we have, and I would disagree with the experts that say that this government has in any way failed any health care or supportive efforts that we have made. But we do need to continue to invest, not only in the prevention of these drugs coming into our community that often do spread diseases such as HIV, and we need to ensure that we're working with the federal government so that there are laws in place that are not only that are stopping these drugs coming into our communities, coming into our streets, and ultimately coming into our province. We need to continue to support those that have addictions challenges, as we spoke earlier, with respect to the immediate support or emergent support that they may need from time to time, but also we need to support these individuals, our family members, all too often. We need to support these individuals in an ultimate road to recovery. That's why we've invested most recently in the recovery beds in Estevan. That's why we continue to invest not only in healthcare here in the cities with our urgent care centers, but continue to invest in the services that are being provided in places like East Central Saskatchewan. It isn't that long ago that we didn't have enough doctors to cover the rural areas of this province. Today, with 900 more physicians working, we do have enough medical professionals to service most, if not all, of the areas of the province, given a few anomalies where we're continuing to recruit between people that have left and people that have came. So this, I would dispute the fact that this government has not invested in supports, has not invested in healthcare, and has not invested in providing those services for people across the province, including those that have contracted HIV. Sure. Right. That money will be part of our $7.5 billion, part of that infrastructure piece. Not directly part of that, but part of that initiative to, to continue to stimulate the economy here in the province and to provide the opportunity for a more affordable lifestyle for our families. It is part of our plan to balance the budget in 2024. This has been accounted for in our efforts in balancing the budget by 2024. That will come without increasing taxes here in the province. That will come through growth and recovery of the economy in Saskatchewan, and we most certainly view this program as being a part of that, stimulating that growth, but also a part of providing a more affordable home and a better home for many Saskatchewan residents. So it's accounted for in our plan to balance the budget by 2024.
Is it inspired by the federal government's plan, and also
Is it which, sorry?
is it inspired by the federal government's similar plan? And will homeowners be able to join both tax credits and renovation?
So the federal government doesn't have one. We would encourage them to consider one. The federal government has been approached by a number of building organizations to implement one just like this. So we would encourage the federal government to mirror what Saskatchewan is doing. We're moving ahead without the federal government. If the federal government should move ahead, and we hope they would, this would be additive to any program the federal government would have. So they don't have one as of yet, but we would strongly encourage you to reach out and touch your MP if you can find a Liberal one in Western Canada and tell them that this is a great program. They're doing it in Saskatchewan. You should mirror it at a federal level.
There's up to $10,000 in expense that could be claimed under the home tax deduction tax credit. Wouldn't that be considered a home renovation?
What's that?
That's on top.
Yeah, this is on. That's ours.
The $10,000 tax credit on the new home?
Yeah. Do you want to speak to that, Donna? Yeah.
Not a lot.
Yeah.
So there is tax credits that have been in place for some time, both federal and provincial, on a new home. This is for renovations. So that's different. But on a new home purchases, there are tax credits, both provincial and federal. Yeah.
Blair, I'd maybe ask you just before we go to the next question, Blair, if you have a minute, just explain a little bit what, as a contractor here in the city, what you think a program like this would do to stimulate, the work that you're looking at over the course of the next year or two.
Yeah, as a small business owner in the construction industry, this will benefit us tremendously and keep Saskatchewan through this crisis moving forward.
And some of the questions that have been here today, about investments and supports for some of those that have maybe been marginalized in our society or are challenged with mental health addictions issues are really speak to why we need to focus on the economic recovery here in the province and why we need to focus on creating jobs, good paying careers in our communities right in Saskatchewan. So a program like this is even more important when we are discussing just how our communities operate and how and who we're providing services. And ultimately, a program like this may provide opportunities for a contractor like Blair to open up one more position over the course of the next year or two, hire someone that where he maybe didn't have someone working with him before, and providing that opportunity to exactly the people that we were talking about supporting in some of the earlier questions. Any other questions? Thank you, everybody. Have a wonderful day.